Dr. Meg Heusser of Mobile Bay OBGYN. She's here to speak about prevention and risk of breast cancer during Breast Cancer Awareness Month. Thank you so much for joining us.
Absolutely. Thanks for having me.
October is Breast Cancer Awareness Month. I guess talk about the best methods of prevention for breast cancer.
Right. So early diagnosis is key. Unfortunately, breast cancer is so prevalent. About 1 in 8 women now are diagnosed with breast cancer at some point in their life. But survival is improving with increased detection and better treatments. So the best screening methods include self-breast exams, clinical breast exams by a trained physician, and mammograms. Mammograms are the gold standard starting at age 40.
We probably all either have a family member or know someone who's been impacted by breast cancer. How prevalent is it? Is it, who is at high risk for this?
Right. So unfortunately, being female is the biggest risk factor. It's just so common. But especially women who have a family history of breast cancer, also other cancers like a family history of ovarian cancer, even cancers like prostate cancer and pancreatic cancer can increase your risk factor of having certain genetic syndromes, which would lead to an increased risk of breast cancer. Also, women who've had a history of chest radiation, those women are at higher risk.
How often should someone be coming into their gynecologist, their OBGYN, to get these checkups, especially if they're high risk or if there's a history of it in their family?
Right. We recommend yearly exams in the office for all women, starting at age 13 to 15. That doesn't always include a breast exam, but from ages 25 to 39, you should be having a clinical breast exam at least every 1 to 3 years. And then from ages 40 up, we really should be doing yearly clinical exams as well as the yearly mammograms.
And as with any type of cancer, it goes a long way if you catch it very early, and that's what you're doing.
Absolutely. Right now, 5-year survival is at 90%, which is amazing. And that really goes to our increased detection methods. So screening works. We just need to all be on top of it and get that screening on time.
The diagnosis, it can be scary, but you guys are making strides in combating breast cancer.
Absolutely. We have a wonderful system at the infirmary with the High Risk Breast Center. We have genetic counselors, we have wonderful breast surgeons, we have oncologists, and we have fabulous nursing teams that really work with a team approach to take care of the patient and their family.
A lot of options out there.
Absolutely.
All right. Thank you so much for joining us.
Thanks for having me.
Thank you.